Hey everyone, this is Shane from Game with Gas, and today we will continue our journey as a budding surgeon with Surgery Squad. Today we're going to be doing a couple more surgeries, starting off with virtual hair transplant surgery. So, for everybody who is looking for hair transplant surgery, we're going to do it here. We're going to learn about it. We're going to get that hair in there. So, without further ado, Surgery Squad, here we go.
Welcome to Surgery Squad's virtual hair transplant.
Hey, Dr.
I'm Dr.
SUZI.
SUZI, and I'll be assisting you with this surgery today. A hair transplant is an outpatient procedure that involves transplanting hair follicles from one part of the body, known as the donor site, to the balding part of the body, known as the recipient site. Although hair transplantations are typically used to treat male pattern baldness and restore eyebrows, beard, or chest hair, they can also be used to fill in scars caused by accidents or surgery. Today, we'll be using the strip harvesting method to treat our patient's male pattern baldness. Strip harvesting involves removing a small strip of scalp from the donor site under local anesthesia and transplanting the pieces or grafts of the scalp into the recipient site of the patient's head. Before the surgery, our patient was advised by his doctor to avoid using any medications that may result in a poor take of the grafts. These medications include, but are not limited to, aspirin, ibuprofen, and antacids. Alcohol use and smoking before and after the surgery can also result in poor graft survival. To prepare our patient for the procedure, we'll need to first shampoo his hair with an antibacterial agent to help prevent any infection. I think you can handle that.
Applying shampoo? Yeah, I think I can handle that. How'd we go? Oh, okay. Okay, leather. Okay, good. There we go. Look at that leathering. I'm leathering everywhere. Oh, man.
So fresh and clean. Thoroughly rinse the patient's hair, and we're ready to get started.
What am I, a hairdresser?
The next step is to define our patient's target hairline. Go ahead and outline where we want the patient's hairline to be.
Sure. I love drawing.
That looks good to me.
Me too.
Let's prepare the donor site. We'll begin by trimming the patient's hair in that area.
Click and drag under the tape. Okay. What does it sound like, a chainsaw? Oh, God.
Now that the patient's hair is trimmed down, we'll need to mark the area that we'll be removing.
This is my area. Give me a texter. For those who are probably not Australian or English, a texter, I think, is called a felt pen, other places.
Great job! Inject local anesthetic into the marked injection sites to reduce the amount of discomfort our patient may experience.
Jab that needle.
Great! He won't feel a thing.
Good.
Now we'll need to remove the piece of scalp we outlined from the donor site. Use the scalpel and cut along the line to begin the process.
I don't like scalpel-based things, but I mean, I'm a surgeon, so I guess a scalpel is, kind of essential. Okay, that wasn't too bad.
Next, we remove the piece of scalp from the donor site. Make sure you have a good grip.
Yeah. Oh, God, that sounded
Once
horrible.
removed, we'll prepare the piece of scalp for grafting by dissecting the individual follicles. But before we do that, why don't you go ahead and suture the donor site?
Sure, yeah, no problem. Let's suture. Let's get that suturing going.
Great, let's get to some dissecting.
Oh God, really?
The first thing that we need to do is cut the removed scalp into sections. We'll dissect this one section of skin while our medical assistants take care of the others. Let's remove the individual follicles from the donor material using a pair of tweezers and a sterile razor.
Remove the follicles. Okay. Ooh. Not quite sure what I'm meant to be doing. Okay. Am I just meant to be cutting this? Okay.
Nice job. This step is repeated thousands of times to get each follicle prepared. I'll have my assistants finish up. To prepare the recipient site, you'll need to first inject a local anesthetic into the scalp. We don't want our patient to be uncomfortable.
By uncomfortable, you mean in tremendous pain because we just cut his head open.
Now we need to make tiny incisions into the recipient site so that we can place the grafts into the scalp. Use the microblade to make the incisions in the recipient site.
The microblade. Oh, it didn't blade properly. Oh God, what's all that stuff? Oh, this is where we're going to put
Perfect.
Okay.
With all of the incisions, it's getting a little messy there. Let's get that cleaned up.
Yeah, let's get rid of the blood. There we go.
Much better. Use your tweezers to pick up and insert the hair grafts into the recipient area.
I've got to insert hair follicle by follicle. This is going to take me like 6 months to finish surgery. I don't think I have enough hair to cover this. Oh, wow. That magical hair on the left-hand side just appeared after I put a whole bunch of these down.
You're a natural. Now that you've got the hang of it, we'll repeat these steps for the remainder of the recipient site. After the procedure has been completed, our patient will be prescribed antibiotics to prevent wound or graft infections. For up to a week after the procedure, the donor area may be sore and some numbness may be experienced as well. Our patient can also expect moderate swelling and redness during this time. Shampooing of the recipient area is typically started 2 days after the surgery. This is important as it prevents scabs from forming. If scabs do form and are left to bond to the hair shaft, the newly transplanted hair follicles may be lost. In about 10 days, our patient will return to have his sutures removed. During the first few days after surgery, almost all of the transplanted hairs will fall out due to shock loss. Shock loss occurs when the hairs are traumatized by their relocation. Within 2 to 3 months, the patient can expect new hair to begin to grow from the treated area and continue to thicken during the following 6 to 9 months. And that's hair transplant surgery. Why not try your surgical skills in another surgery here on SurgerySquad.com?
Wow, that was pretty good. I think it's pretty monotonous, the replacing hair by follicle, but hey, it looked good. He was smiling at the end of it, so I guess that we had a bit of success there. Next on our surgery list is laser hair removal. So here we go.
Welcome to Surgery Squad's virtual laser hair removal. I'm Dr. Jeff, and I'll be assisting you with this surgery today.
Who are you,
Everyone
Dr. Jeff?
gets hair where they really don't care to have it. Fortunately for all of us, we have the option of laser hair removal. Laser hair removal is a non-invasive cosmetic procedure that uses a laser to remove unwanted hair. The energy from the laser damages the hair follicle, which reduces the hair's ability to grow. Although laser hair removal is an incredibly popular procedure, not everyone is a good candidate. The best candidates are those who have hair that is darker than their skin. Individuals who have a darker complexion or lighter colored hair may have their skin inadvertently damaged by the laser. These individuals may also need more treatments to get rid of the unwanted hair. Our patient today is a male in his 30s that wants to get rid of some unsightly back hair. As you can see, he is an ideal candidate since his hair is darker than his skin. I've already given our patient special goggles to protect his eyes from the intense light that is emitted from the laser. To get things started, we first need to shave the treatment area.
Is the treatment area all of this stuff? I'm just going to cream you up. God, it sounds like a forest fire. So how much more of this am I doing? Oh, here as well? Oh, no, now we're razoring. Yeah. Oh, man. Do doctors really have to do this?
Great. Next, let's apply a topical anesthetic to the treatment area to reduce the amount of discomfort our patient may experience.
Okay. Whereabouts? Here? Everywhere? Yeah, everywhere. Let's grease up that back. Oh, look at that anesthetic. Your back is going to be so numb. Why couldn't we inject something into his back? An anesthetic. I mean, I'm a surgeon now, so I should be able to have an opinion on stuff. Oh, God. We're going to run out of antiseptic cream at this rate.
Now that the topical anesthetic is applied, we'll need to wait about 30 minutes or so for it to take effect.
30 minutes?
The anesthetic has set in. It's time to zap some follicles. The most important step of laser hair removal is to get rid of the unwanted hair using our laser. As you guide the laser over the treatment area, it shoots tiny bursts of energy which travels through the skin and is absorbed by the hair follicles. By doing this, we're damaging the hair follicle and reducing any future growth. Why don't you try it out?
Ooh. Good? Is that good? Just before I continue, I'm not sure about you, Dr. Jeff. I want Dr. SUZI back. You're making me do a lot of stuff here. Screw that. You can have spots on your back.
Perfect. Are you sure you haven't done this before? After the procedure has been completed, our patient's skin may appear red or irritated. Luckily, this lasts only a day or so. It's extremely important to avoid the sun or use sunblock for a few weeks after the procedure, and avoid any plucking or waxing of the treatment area. Immediately after the treatment, our patient can apply cold compresses to the area to help alleviate any discomfort. Within a few weeks after the procedure, he may notice some new hair growth from the treated hair follicles that were inactive at the time. Because of this, our patient may need to undergo multiple treatments. Most individuals receive a total of 6 to 8 treatments before achieving desired results. The overall results of each treatment rely greatly on an individual's skin tone, hair type, and growth phase of the hair within the treatment area. Laser hair removal may not prevent hair from growing completely, but after multiple treatments, it can significantly reduce the amount of unwanted growth. And that's laser hair removal. I couldn't have done it better myself. Why not try your skills in another surgery here on SurgerySquad.com?
Okay, and next on the agenda, liposuction. I'm not that sure about Dr. Jeff.
Welcome
Dr.
to
SUZI.
Surgery Squad's virtual abdominal liposuction. I'm Dr. SUZI, and I'll be assisting you with this surgery today.
Yeah, screw you, Dr. Jeff.
Liposuction is a minimally invasive surgical procedure that is used to remove fat deposits from various areas of the body. The areas that liposuction is generally performed are the abdomen, hips, inner and outer thighs, flanks or love handles, and inner arms. Today we'll be using the tumescent technique to remove fat deposits from our patient's abdomen. The word tumescent means swollen and firm, and with this technique we'll be injecting such a large volume of the fluid into the fat deposits that our patient's abdomen literally becomes tumescent. After injecting the fluid, we'll be using a hollow metal tube called a cannula to break up and essentially vacuum fat deposits out of the body. Before we begin, remember that liposuction is not an alternative to diet and exercise, and unfortunately, not everyone is a good candidate for liposuction. To be a good candidate, one must usually be over 18 years old, in good general health, be within 30% of their ideal weight, and have made an honest attempt at losing weight through dieting and exercise with little success. Luckily, our patient is not only a great candidate for liposuction, but she doesn't smoke, which will greatly speed up the recovery process. Now that we've covered the basics, let's scrub in. The first thing we need to do is mark the target area. This provides our patient and ourselves with a clear idea of where we'll be removing fat deposits. Why don't you give it a shot?
I've got to draw all of this, do I? Okay, that's absolutely terrible. Okay, an artist I am not.
That looks great.
Yeah.
Now we need to take photos of our patient so she can see the before and after results.
Oh, wow.
Go ahead and take one picture of the front of the patient's abdomen and one picture of the side.
Okay. Cheese.
Next, we'll have our patient turn to the side so you can take the second picture.
Okay. Say happy.
Nice composition. Our patient has been prepped and is now in the operating room. The next step is to numb the incision points that we're going to use to extract the fat deposits. Give it a try.
I'll numb you and you and you and you.
With the incision points numbed, we're going to inject the tumescent fluid using an infiltration cannula to anesthetize the target areas and dislodge the fat deposits, making it easier to suck them out. Go ahead and take a stab at it.
Oh, God, look at this device, which is kind of all over the place. Click each incision point. Okay, I am clicking the incision point, I think. Am I not? There we go. Oh! God, that sounds like a drill. Am I just creating an incision point? Or, yeah, I think I am. I haven't injected the fluid yet. Oh.
Excellent job. Now that we've injected the tumescent fluid, let's begin the liposuction. Use the suction cannula to remove the fat deposits from the patient.
One more.
You're a natural. Have you ever considered a career in the medical field? Now that we've completed the liposuction on our patient, it's time for recovery. We're not going to suture the incisions. Since they were so small, they can heal without sutures. Our patient will need to wear a compression garment for 2 to 6 weeks. This garment holds the tissues together, controls swelling, and provides additional support as her body heals. She should be able to return to normal activity within a few weeks, and there will still be some bruising that should fade within a few days. Any swelling that our patient has may take a little while longer to subside. The final result of the liposuction will be evident in about 1 to 3 months after the surgery, although they will see a noticeable difference within days or weeks. Although the suctioned fat deposits are gone, if the patient does not maintain a proper diet and exercise regimen, the remaining fat deposits could enlarge, creating irregularities in the patient's abdomen. And that's abdominal liposuction. You've done a fantastic job. Why not try your surgical skills in another great surgery here at SurgerySquad.com.
And now we've reached the finale, the final piece of cosmetic surgery that we can perform, rhinoplasty.
Welcome to Surgery Squad's virtual closed rhinoplasty surgery. I'm Dr. SUZI. Today
SUZI.
we will be performing rhinoplasty. It's what's commonly referred to as a nose job. In this cosmetic surgery, our patient is a young lady who's looking to change the shape of her nose. We'll perform a closed rhinoplasty procedure to reshape her nose into something she finds more appealing. Some surgeons will perform this surgery using a local anesthetic and sedation, which makes the patient numb and in a dreamlike state. I prefer to work with a patient under general anesthesia and completely asleep. What we're doing today is reshaping the bridge of the nose. Our patient feels it's too wide and doesn't like the hump on it. The thinning of the nose is called an infracture. I'll bet you can't guess what the widening of the nose is called. All right, I'll tell you. It's an outfracture.
Ooh, close.
Some patients may also want the tip of the nose reshaped. That's called typoplasty. But as I was saying, this patient only wants an infracture and some reshaping. Easily done. To begin this procedure, we need to open the nostrils as wide as possible. We do this with a retractor. Can you place the retractor in the patient's right nostril?
Oh God, I don't like where this is going. The nostrils are pretty big right now. Are you sure we need to make them any bigger?
Now with the nostril opened wide, we'll make an incision inside in a crescent moon shape. That will allow us to access the bones and cartilage that make up the nose structure. I've made the incision. Can you use the forceps to remove that portion of the nostril?
Sure, yeah.
Surgeons must be hyper-vigilant when doing this portion of the procedure, as it can damage breathing and sense of smell. To reshape the nose, we're going to chip off the dorsal hump with a chisel tool called the osteotome. We place the osteotome at the base of the hump and then carefully tap on it with a small rubber mallet. This has to be done very gently and takes a careful touch. I'll position the osteotome and you tap the end with the hammer.
Do you seriously want me to tap this giant metal rod into this person's nose? Okay. That is not gentle tapping. That is very extreme tapping.
Now that the hump is loosened, we need to pull the bone and cartilage out of the nose. Use the tweezer-like forceps to slip it out of the incision. Now that the bump is out of there, we need to smooth the edges on both sides with a rasp. The space left by the bone we've removed is referred to as an open roof. To close the open roof, carefully tap the osteotome along the path that I've marked. This breaks the nasal bones so we can reposition them. Tap the osteotome once each time I reposition it on the left and right nostrils. Now that the bones are broken, I just take my fingers and reposition them to close the open roof. Because we made such perfect breaks, the bones slip right into place and the nose is perfect. A few stitches to close up the incisions, and then we place nasal airway splints in each nostril to hold things in place. Steri-strips go across the nose, and an external nasal splint is added to hold everything tight.
Man, she's bruised up. She looks
Our
terrible.
patient will have some bruising and minor pain for a few days. We'll remove the splints in about a week. Most of the swelling will be gone by then, but there can be a bit left for a few months. And there we have it. Thanks for coming by. Catch more of my great surgeries here at surgerysquad.com.
Okay, so that concludes our day of cosmetic surgery. I hope you enjoyed seeing that. I certainly learnt a whole lot and know that I don't want to have any part of any nose job because I feel very uncomfortable about putting metal rods up people's noses and hammering them so they can break their nasal passages. I don't know, it's just me. I'm just uncomfortable with that. So we will continue with more Surgery Squad. There are other categories of surgeries that I will do later. So looking forward to that. But until that next video, I will see you then.